So it's my privilege to introduce you our next special guest at our symposium, Minister Sylvia Jones. Minister Jones is Member of Parliament for Dauphin-Caledon. She's currently the Ontario Deputy Premier, and Minister of Health, where our focus is building a more connected and convenient healthcare system for all Ontarians. In her role, Minister Jones has worked with healthcare partners from across Ontario to introduce and pass the Your Health Act to ensure Ontarians have faster access to publicly funded surgeries and procedures while growing the healthcare workforce. Introduce and pass the Convenient Care at Home Act to modernize and better integrate home care services. Make the largest investment in pediatric care in the province in history. Launch the government $2.1 billion primary care action plan to connect every person in the province to primary care by 2029. Break down barriers to make it easier and faster for internationally and interprovincially educated healthcare workers to register and start working in Ontario. Get shovels in the ground for over 50 hospital redevelopment projects that will add more than 3,000 new hospital beds within the next 10 years. Previously, Minister Jones served as Solicitor General, where she led the Ontario COVID vaccine rollout and championed public-funded initiatives, including leading the country with 307 million anti-human trafficking strategy and legislation, as well as passing Canada's toughest animal, the toughest animal protection legislation. She lives in Dauphin-Caledon for 30 years with her husband, David. Mesdames, Messieurs, Sylvia Jones.
Hello, everyone. I'm Sylvia Jones, Ontario's Deputy Premier and Minister of Health. Thank you to everyone involved in organizing the 4th Annual Symposium on Antimicrobial Resistance, including bioMérieux, the University of Toronto's Emerging and Pandemic Infections Consortium, the Canadian Antimicrobial Resistance Network, the McGill AMR Centre, and the AMR One Health Consortium. This week, experts, researchers, industry leaders, and policymakers are coming together to discuss the threat of antimicrobial resistance and how we can fight it. On behalf of Premier Ford and our entire government, I would like to thank all of you for your work on this important issue. We recognize that AMR is a global health concern. As you come together as health professionals, industry leaders, Indigenous representatives, and patients to share knowledge and drive innovative solutions that protect the effectiveness of antimicrobial for future generations, we understand the necessity of responsible antimicrobial stewardship. Building awareness of this issue is the first step towards making meaningful change. That is why we continue to track and monitor trends related to antimicrobial-resistant organisms. And Public Health Ontario, a leader in scientific expertise on AMR-related matters, to share best practices in order to reduce the transmission of antimicrobial-resistant organisms in healthcare facilities and improve our surveillance on infectious disease trends. That is also why we continue to support antibiotic stewardship initiatives aimed at improving prescribing practices in partnership with Ontario Health, which provides prescribing feedback to providers, helping to reduce AMR transmission. Our government is also doing its part to strengthen infection prevention and control through investments in Infection and Prevention Control Hubs, or IPAC, which supports congregate living settings with their implementation of IPAC best practices to protect vulnerable populations from AMR organism transmission. Just last week, our government opened the new West Lincoln Memorial Hospital in Grimsby, the first new hospital in Ontario to include all single-patient rooms, further strengthening infection control. I want to thank you again for all your contributions to addressing the threat that AMR poses and protecting the health of Ontarians and our healthcare system. I hope you have an informative and engaging symposium. Stay well.
And now it's my great honor to introduce you our keynote speaker. Dr. Jean-Pierre Nyemazi served as the director of the Quadripartite Joint Secretariat on Antimicrobial Resistance. When we say quadripartite, you may ask yourself, what do you mean? Well, it includes the Food and Agriculture Organization, the United Nations Environment Program, the World Organization for Animal Health, and of course, the World Health Organization, as he served as the head of the Government and Strategic Initiative Unit in the AMR Department at DO. Leading a dedicated team, he advanced multi-sectoral action against AMR, focusing on the implementation of the United Nations General Assembly Political Declaration on AMR and other global commitments. His work also supports the functioning of the global government structure for AMR, including the Global Leaders Group on AMR and the AMR Multi-Stakeholder Partnership Platform. Before joining the WHO, he held the position of Permanent Secretary of the Ministry of Health of Rwanda. Mesdames, Messieurs, Dr. Jean-Pierre Nyemazi.
Thank you so much for your kind introduction. Just checking if you can hear me. You can see my slide as well. Very good. Thank you so much, and bon appetit. I know it's lunchtime for you. Close to my dinner time here in Geneva. Just apologies in case you see me fading all the way. We are almost at the end of the day here in Geneva, but I'm very pleased and actually honored to be able to participate even remotely in these discussions. And again, apologies for not being able to come and be with you in the room and have this conversation. I'll run through a few slides just to update you on what is happening at global level. And I know some of you as well, you are very much involved. So feel free to interject or send comments or even ask questions as we move along the presentation. I think from even what the minister said, AMR is a global threat for both health of people, animals, plants, but as well as a challenge to the development. When you look at the most recent figures, AMR is still claiming about 1 million of people every year. And these are the direct death contribution by the drug resistance pathogen. However, all in all, the associated death amounts to almost 5 million every year. And we've done as well estimates of the economic burden of AMR. And we could see that close to $855 billion will be lost annually due to, one, the burden of AMR. Let's say, expenditure going to be increasing due to additional healthcare expenditures, due to treating the drug resistance pathogens and the patients, of course, but as well the loss of productivity because people will stay longer in the hospitals and so forth. And you have the same estimates that are really close to what the World Bank as well estimated back in 2017. And beyond the health sector now, you could also see that it's estimated that about 11% of decline in livestock productivity by 2050 if we don't do something to address AMR. Now, the most recent statistics as well published by the WHO GLASS report that most of the countries are now reporting it to, we have found that out of 6 lab-confirmed bacterial infections, 1 is already caused by drug resistance bacteria. And we also found that the AMR or the resistance is increasing annually in the range of 5 to 15%, depending, of course, on the drug combination and different pathogens. And as you can see on this slide, it depends as well on the type of sample you're taking, but you see that most of, you have this range 1 to 3, 1 to 6, 1 to 15, depending on which sample you're taking. But the overall message is that resistance is still increasing, and it's really alarming, as my previous speakers mentioned. Now, the same data also showed us that the AMR disproportionately affects countries with lower income and fragile health systems. And you might think of different reasons that are causing this status. So with inadequate RAB facilities, lack of access to appropriate therapies or antibiotics. So there is a tendency that the misuse or inappropriate use will happen, and then therefore the resistance as well might develop. So this also shows us that there is also a burden that's not disproportionate, that is disproportionate, affecting different parts of the world. Now, you might ask me now, what is the global status in terms of addressing AMR? And we have a report, it's a self-report by countries, and we have now close to 184 countries that are reporting on an annual basis. And they report on several indicators. I just chose a few here so that we can have an idea of how the countries are addressing AMR. You might all recall that it was a commitment by all the member states back in 2016 that they will go ahead and develop multi-sectoral national action plans to addressing AMR. That was achieved. Now close to 88% or 90% actually, 91 here, as you can see in the slide, have developed their national action plans across the sectors. So they are multi-sectoral national action plans. But as you can see, only 21% are actually reporting that they are fully implementing and monitoring and financing the plan. So that tells us that most of these plans are just in the shelves. They are just developed and probably to be shown, but they're not really implemented. And that brings an issue. Probably that's why we see the alarming numbers year after year. Now, yeah, a few more statistics here that will be very quick. 57 of countries, have the national action plans linked with another plan. Why is this important? Is that a national action plans on AMR should be mainstreamed in the national health security plans, in the national development plans, in several plans. 46% have all sectors listed involved in AMR sectoral coordination. So why is this important? Without appropriate coordination across sectors, the response is inadequate because you have a sector, let's say animal sector, doing it their way. You have human health sector doing it their way. And there is a need really to coordinate across sectors to have an efficient response. Only 14% have really evidence-based behavior change strategies. Behavior change is a key strategy, as you remember, from the Global Action Plan. And 58% have standardized AMR surveillance system. So you can see that really all of these indicators are showing really merry progress year after year. Now, I also wanted to show this path, and you probably all are going to recognize a different key moment here. And let me add as well a few more here. 2014, that's when the global level, we had the first ministerial conference on AMR. A ministerial conference on AMR is really important because it brings together the ministers across all the member states and across the 4 sectors: health, animal health, environment, agri-food. And they meet and they discuss AMR because AMR as well requires a multi-sectoral response. That meeting was critical because that's when the Global Action Plan on AMR, which you all know was approved in 2015 by the WHO, was started to be discussed. So 2015, we have the Global Action Plan on AMR. 2016, we had the first ever UN General Assembly political declaration on AMR, which was a critical and a turning point because from that declaration, that's where most of the member states made some big commitments, including developing the national action plans. And other commitments that were made there included to bring the 4 UN organizations. At that time, it started by the 3. It was WHO, FAO, and the World Organization for Animal Health. And then in 2022, the UN Environment Program joined. Then it became a quadripartite organization, as the moderator introduced. So that is when really the One Health approach and making it, I would say, a mandatory, or let's say, giving it more energy and giving it more mandate started in 2016. And you could note as well, I put a few logos here to show that that meeting of 2016 and that movement, global movement, especially with political movement, started to see most of these key organizations being established. We can note about CARBEX. I think you might know about CARBEX, AMR Industrial Alliance, GovDP, AMR, Global AMR&D Hub, the Pay Impact Fund, AMR Action Fund. So all of these organizations really came to exist because of this momentum that was really mounting, and they have helped a lot. They have helped a lot in different settings. Now, moving fast, some additional global governance structures were established. In 2020, we had the Global Leaders Group. I'll describe the Global Leaders Group in a moment. Then later on, we had what we call the multi-stakeholder partnership platform, which was also developed and established. Then we had a high-level meeting last year. That was the second on AMR, and I will speak about it as well. And then we had additional ministerial conference as well, one in 2019, another one in 2022, and another one in 2024. So just to give you a picture on how globally the momentum around AMR has been developing. Now, I don't want you to necessarily read everything on this slide. Apologies, it's really packed. But I'm giving you a picture of what the political declaration of last year did include. And I want to just to mainly laser focus on this mortality reduction. So the world has given itself a goal to reduce 10% of AMR-related death by 2030. So out of 1 million, out of the 4.7 million, although the target was based on 2019, I can also go back there. It was, at that time, was 4.9 million a year. Then the commitments here is to reduce it by 10% by 2030. Then there is a number of things we need to do to be able to achieve that, and actually can maybe go beyond that. And there are some studies. We really thank the academia. They are bringing great numbers, great researchers, great studies that are informing us what to do in order to reduce the 10%. But the political declaration, if you have time, you could read it. It includes around 45 commitments by the member states, spanning from the governance, financing, access, multi-sectoral response, specific sectors like human health, agri-food, environment. They are talking about diagnostics. They are talking about surveillance. They are talking about follow-up. So many good political statements, ambitious goals are here now for us to implement. Now, the Quadripartite Joint Secretariat, which I'm honored to be the head, is again a central coordination mechanism that has been established by the quadripartite organizations. We've been there for the last 6 years. And among others, we support the global response on AMR by hosting these key global governance structures. We are the one responsible for updating the Global Action Plan, for example. We are one hosting some of the financing schemes like the Multi-Partner Trust Fund. And we support as well countries by providing the key standards or normative guidelines, but as well, we do that jointly among the 4 organizations. And on the picture here, you can see the 4 principles, the 4 DGs of WHO, FAO, the former DG of WUHA, and the current executive director of UNEP. They signed a cooperation agreement to work together. So we work under this leadership, and we are there as well to support the member states in this journey. Now, we do a lot of things. I don't want to dwell much into what we have been able to do, but just a few products that we want to just mention here. So in terms of financing, we support the financing for mainly the low and middle income countries. We don't have the funds. The funds are coming from different member states. And I've been actually discussing with our counterparts in Canada. We believe Canada also can be a key donor or a key resource partner to support this funding, because we believe the AMR is a cross-border issue. And if all of us will put together all our efforts, I think better will achieve the targets that we have set. But as well, we serve as a one-stop shop for the member states when they want to know where is the funding. So we try to map the existing financing mechanisms and the funding resources so that we can inform the member states when they want to implement their national action plans. We come up with some of the normative guidelines. I think probably some of the experts in the room are aware that we have been developing an integrated AMR, AMU surveillance guide. It's going to come soon. We've been developing the investment case for AMR. We have been putting together the regulators across human health, animal health, environment to talk about AMR regulatory measures. We've set up a One Health priority research agenda for AMR. And also we came up with One Health legal assessment tool, because we believe, especially for the parliamentarian, we need to give them some tools they could use to assess if there are some laws and policies that have to be put together in order to addressing AMR. We have as well advocacy instruments, and we host the youth working group. We have the AMR task force of survivors. I think you got an opportunity to listen from Rob, who gave some testimonies. And also, of course, coordinate the global response by bringing other partners together and discussing the issue. The AMR Multi-Partner Trust Fund, as I said, it's a fund that we manage. It's supporting LMIC's countries. So far, we have supported close to 21 countries, and we're very thankful to the current existing financing partners: the UK, the Netherlands, Germany, Sweden, and EU. And as I said, we have now a target that came from the political declaration that we need to mobilize at least 100 million to catalyze the implementation of the multi-sectoral national action plans. So that's why we're looking forward to approaching many donors, many resource countries, to see if we can contribute all together to this fund, and then support many countries that are struggling to be able to address AMR in a multi-sectoral context. Now, speaking about the AMR global multi-sectoral governance, I know you might also have in Canada and in different other places the way that you cooperate or coordinate across the sectors. So globally, we have also established some global governance structures. You might be aware about the Global Leaders Group on Antimicrobial Resistance. It's a group of individuals, high-level political individuals, who have been put together since 2020, December 2020, and their role was to catalyze political action against AMR. It's a very effective group. It is led by Her Excellency Prime Minister Motri of Barbados, and it includes other high-ranking individuals, political policymakers, and as well other leaders, and the principals of the Quadripartite organization as well are a part of the group. Some of the key achievements by the group, they have been really the voice, reaching out to the other political or policymakers, head of governments, heads of states, to try to bring AMR on top of the agenda. And it has been successful. And the last high-level meeting on AMR as well was one of the fruit of this group that went out and started to advocate for AMR to be discussed at such high level. Now, the second one here is the antimicrobial resistance multi-stakeholder partnership platform. I hope some of the colleagues in the room as well are part of this important platform. It now has about 300 entities. So we enroll institutions, let's say countries or private sector or civil society, academia. So it's open for all the institutions that are operating in the space of AMR. And then it's really a platform for convening and sharing because that's critical. And you might have seen that most of the current ongoing consultations around, let's say, the updating of the global action plans or establishing the independent panel, we have been conducting them through this MSVP, and it's really very helpful. Now, coming to the third one, which is the independent panel on evidence for action against AMR. As you can see, we have the political advocacy, and then we have the convening, or let's say the coordination aspects of different key players. Then what we lacked was really the evidence so that you have a complete governance structure. So the evidence or the science and advisories to the countries, we are hoping that we'll be able to establish this independent panel relatively soon so that this gap can also be bridged. So I will speak about where we are with this establishment in the coming slides. So going so fast here, I will not dwell much on this slide. I will leave all of the slides with you. But we also worked on different advocacy messages that are tailored to specific groups. And we thought about parliamentarians. Parliamentarians are critical in terms of how they vote the laws, how they enforce the laws, but as well how they held governments accountable to some of these key policies. So we have a complete set of tools that parliamentarian can use, but as well as you can see through the slides, all of this that we ask the parliamentarian to do as well, we can also do it in different other settings, looking at the accountable governance mechanisms of AMR, strengthening registrations, promoting investments in AMR or even other areas that are relating to AMR. So all of these have to be done, and we have been meeting parliamentarians across the globe to try to push the agenda moving forward as well. I'm sure you spoke about the issues around research and development and access, and I just want to add my voice into this. So when you go to the discussions we've been having globally, we are all aware that the antibiotic pipeline and access is now a crisis, but as well it requires an overarching solution. So different initiatives coming and tackling some areas of the value chain will not really be sufficient. So we need really a complete solution. We need to stimulate the research and development, but as well at the same time, we need to safeguard the access. And at the same time, we need also to work on the stewardship. So when we thought about this solution, and we have a few recommendations that I'm happy as well to share more details about. So we gave a few recommendations to different institutions on what needs to be done in order to mitigate the crisis around the antibiotics and as well the access. So we need to work together. Yes, of course, we need to have the governments in the leading positions, but the private and the public have as well to coordinate in terms of funding. So we look at the push, but also look at the pull incentives. And we simply highlighted that the G7 and G20 have a strong role to play. And I'm glad to see that Canada is moving as well in that direction. So we also think that other areas have to be strengthened. National and regulatory bodies have to be strengthened. Global coordination across research and development and access continuum. These also have to be developed. Embracing the technology as well. That's also a key in terms of the strategies that we are pushing forward. Now, coming back to the current important actions that are happening with us and that we think all of you should be involved into. I spoke about the Global Action Plan that was approved back in 2015, 10 years now, and it has been requested by the member states, all the member states, the countries, that we need to revise the action plan that we have since 2015. And we are already doing that. As you can see on the slide, you can see where we are. So the process started in the beginning of this year, and we consulted many of you probably, and we have already consulted now with the member states. So we have now a new global action plan that's going to go through different approval process, including the World Health Assembly and other quadripartite governing bodies. The key changes, as you will see, is that this is really now a true One Health global action plan. The previous one was heavy on human health, of course, because it was developed as well by the WHO. But nowadays, the newer plan had to be really reflecting the true One Health approach. That is something that you'll see that has changed. Now, the other thing that changed, and I'm highlighting here on this slide, I'm putting on the left the gap 2015. So you can see we had 5 pillars. Improving awareness and understanding, that was the first one. So this time around, we want to take another step and say, strengthen awareness and promote appropriate social and behavioral change. Because we believe now many people do know what AMR is, and what to do, but not many people are doing the right thing. So we think that the next plan should really be much focusing now on the behavioral change. The second pillar, it's about knowledge and evidence-based. That's in 2015. This time around, we're making it more broader, and we are really being very focused on surveillance system and diagnostic networks, because we believe we've improved diagnostics, we get better data, but as well we get better, or actually better patient outcomes. The pillar number 3 was about prevention. Now we keep the same, but we are becoming more broad. So we're talking about prevention not only in health facilities and communities, we're also talking about prevention in farms, in agricultural plantations, in different areas. The fourth one was the use of antimicrobial medicine. This time around, the new gap, as you can see, we are now really very focused on equitable access, appropriate use, and disposal, because the disposal is also becoming a key component of the AMR response, because if you don't dispose the antibacterials or antimicrobials in the environment, it can also be a storage for antimicrobials or different other particles that could now also increase the type of resistance that we are seeing. Number 5 was about economic case for sustainable investment. This time around, we are changing it to be focusing on financing for action, because as I told you, 21% actually are reporting that they have financing in place, 21% of the countries. So that's not sustainable. That's not going to bring us anywhere. So this time around, we want really to emphasize on the need that AMR should be financed in all the teams. Now, there is a new objective we have added, which we believe is important, which is about coordination and governance. So multi-sectoral coordination, governance, sustainable financing is pretty critical, very critical, because otherwise we'll still have some sector-specific or some different initiatives around the countries or subnational levels, and then you don't get a big impact. Now, let me speak a little bit again about as well the independent panel, because I'm also sure that most of the experts in the room are interested to understand where we are heading with this. So the independent panel on evidence for action against antimicrobial resistance, or we call it IPEA, it's also a recommendation from the political declaration on AMR. However, it's not a new request. Back in 2019, again, that was a request by the member states, and we did not succeed to establish it. But nowadays, we have now started, and the work has progressed. And I'll tell you a little bit more about what we have been doing. As you can see, the scope and objectives of the panel is to facilitate the generation and the use of multisectoral scientific evidence to support member states to tackle AMR. How will this be achieved? Using existing resources. Existing resources means the panel will not create new science or evidence. Where the evidence is, the panel will just synthesize or review, will just use what is available and try to generate the evidence or the advisory notes to the member states and other stakeholders on how they could improve the AMR response. As you can see, their functions will be to conduct assessments in an independent manner. The assessment should be authoritative and should be really targeting the real issues that are being faced by all the implementers, but mainly the member states. Horizon scanning, we believe the group as well will be doing that job of identifying and prioritizing overlooked or emerging trends, risks, and impacts. So that's one of their functions. We believe the team or the panel will also share information and identify and highlight research gaps, because we believe as well there are many areas where we don't have evidence in terms of addressing AMR, but as well in terms of how the resistance is being transmitted across different areas or different sectors or different species. So we believe that also the IPA role going forward. And then policy support, here we mean they should also be able to be available in the discussions at the political level to be able to advise in the policy making process. Now, the process as well started long ago. However, we ramped up all the efforts during this year, 2025. And you might have been aware that we've been reaching out to different experts, and we have collected through the surveys the key component or at least to get to understand what the experts really need or what the countries need to see. Now, where we are today, we have a draft. We have draft documents, and I will share with you the link. Then you can go there and read all the documents. So we have a document that really defines what's the vision we have for the panel. These are not final documents because we are requesting the member states to give their feedback on those documents that we developed. However, what we proposed, just to give you a sense, we propose that it's going to be constituted by an expert committee. We are thinking of having 30 experts across all the sectors, both from the biological sciences, but as well other sciences, social science, economic sciences, policy sciences. And then that panel will be really the committee that will be receiving the requests from the member states and other stakeholders of the key issues to be discussed. And then they will commission the evidence gathering activities or research activities if that's needed. And then they'll come up with a report that will be now shared with all the member states through different fora. So where we are now, we have those drafts that have been sent to the member states, and then we had even this morning an information session with many stakeholders to just try to explain what we have developed, and we're hoping to get their feedback, and then we can move forward with the establishment of this panel. Now, we also have AMR advocacy, and as you know, we are working in different areas in terms of advocacy. We have identified the media. Media is a key constituency that we have to work with. As I said, parliamentarian and policymakers, they are very key. And then patient and survivors, because what we lacked before, as you can agree with me, is that AMR remained as a complex, intangible issue that most of people do not really grasp. And I'm talking about the normal citizen, including also the general population, including the politicians, actually. But now, the fact that we have now developed some tools and actually been lucky to have the AMR survivors or people who went through this hell of contracting or having their beloved ones going through this very difficult moment of having a drug resistance bug and disease, they have been very vocal and they have been more convincing actually to bring people on board and to understand that AMR is something real and it's something is a threat that is really important to be addressed. I will not finish my talk without mentioning that we are now on the second day of our World AMR Awareness Week in 2025. Act now, protect our present, secure our future is our theme. We put together many materials and I can share those with you as well. And we want all of you, everybody, to go out there and really spread the word that we need to address AMR. And really, it's an urgent thing we need to do now. It's not something for tomorrow. It's something that's already we have in the front, and we need really a quick action to this. And as you can know, we go blue. I mean, it's a campaign that we started back in 2021. I'm not in the room, so I can see if you're putting on blue today. I mean, it's just a symbol. It's small, but it's a recognition that we're all really caring about this threat. As you can see, I put there some great people, partners in different countries who have really been doing a lot in terms of raising the awareness for AMR, and we've been lucky to have some leadership really agreeing to use even their national monuments to light them in blue so that we keep raising this issue for greater attention. I know most of the work will happen beyond this, but it's also important to still raise the awareness and call everyone to come to work with us on this. So I want to thank you again. I'm sorry if I've been too long, and I hope that was useful still. And I'm happy to take one or two questions or hear from your comments, if any. Thank you so much for the opportunity.
So if you want to have a question, please present yourself to the microphone. Or do we have a question online? 1, 2, 3. So just to let you know, Dr. Nyemazi, the AMR Symposium will group expert, patient, and indigenous community representation, decision makers. We had the presence virtually of the Minister of Health of Canada and the Minister of Health of Ontario. So I would say on behalf of all our participants, you at the global level, you can count on us. You can count on our commitment to support your efforts. J'aimerais vous dire, on se revoit bientôt, on se reparle bientôt et votre présence est toujours très, très, très appréciée ici. Merci de votre temps beaucoup. Thank you very much and see you soon.
Merci beaucoup, c'est un plaisir. Comptez sur nous aussi.